Dr. Robert Finberg, professor of medicine at UMass Medical School in Worcester. Doctor, it's Friday. We always appreciate your time and your wisdom. Cruises have a hard time convincing anyone, including health officials, that they're a safe place to be during a pandemic. So in this case, and this is the concerning part, everybody was vaccinated. They were tested before the trip. So how do two passengers return to shore with COVID-19?
Okay, well, and it was on a cruise ship, so it wasn't somebody flying in, and it wasn't Colonel Mustard in the billiard room, I don't think. So
good clue reference, good, okay.
So the vaccines are incredibly effective. However, of course, 95% effective means that it's possible that some people could still get disease. I would point out that if you get a test within 72 hours, that doesn't mean that somebody could have become positive after the test. So what happened here? Well, these people actually, is my understanding, were not actually sick. They tested positive for the virus. It's likely, from my point of view, that someone became test positive after their test was read as negative. And it's also likely that these people benefited from the vaccine. And if they had not been vaccinated, they might have had symptoms or been much sicker.
Okay, well, Dr. Finberg, we want to remind our viewers you're on Governor Baker's Vaccine Advisory Board. So we're hoping to talk about the state's numbers. 2/3 of the population now has received at least one dose. What can you tell us about the other third, who they may be? They can't all be kids under 12.
No, they're not all kids under 12, and we haven't quite reached our goal yet. Some of these people were people who couldn't come to the mass vaccine sites, and as a result of that, local health departments are setting up ways to get to those people, and there are pop-up vaccine sites which offer transportation. Others have been hesitant for a variety of reasons, and I'm hoping that the overwhelming evidence will convince them to come out and get the vaccine.
Doctor, this week the state did extend the expiration date for Johnson & Johnson vaccine, saying that they could stay in the refrigerator for an extra 6 weeks. So are you comfortable holding on to those doses for a little longer and still distributing them?
Oh, absolutely. This is based on data from the manufacturers, which has been coming after they were marketed. And of course, the advantage of the J&J vaccine is that it's a single shot and easier to store. So I'm certainly comfortable with it.
All right. And Dr. Finberg, Governor Chris Sununu up in New Hampshire, he recently announced he's not ordering any new vaccine doses. There's just not enough demand there right now. Is that something Governor Baker is considering?
Well, we haven't reached Governor Baker's goal of 4.1 million people fully vaccinated, so it's certainly not time to stop. And summer's coming. You know, I think people may want to move to Massachusetts or vacation in Massachusetts, and we certainly don't want to be without vaccine. So I don't think we're ready to stop yet.
Really quick question before you go, doctor. So you are fully vaccinated, which I think I've asked you that question almost every time I see you. You're comfortable. Are you going into stores right now? Say you go to the supermarket. Are you not wearing your mask? You personally?
Personally, what I want to say is that people should do what they're comfortable with. There is no harm in wearing a mask. I'm comfortable, but when I'm around patients, I don't want to get the disease, and I do tend to wear masks. So I think it's okay to wear a mask.
Okay. Thank you, Dr. Robert Finberg, professor of medicine at UMass Medical School in Worcester. Have a great weekend, doctor. Stay well.
Thank you.
Thank you.